Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. As we continue, happy Nurse Practitioner Week. I hope you've been having an amazing week, and I wanted to give you our offer for today. So, Nurse Practitioner Week offer for today by 11:59 Eastern Standard Time before midnight strikes. I am allowing y'all early access to the Black Friday deals to include the basic bundle. That is $168.99. It's over $100 off. You get the full QBank bundle as well as the paperback FMP and AGMP review book. The ultimate bundle for $374.96, you receive the paperback book shipped to you. You get the full QBank bundle with all of the practice questions and the practice exams. You get the review course as well. So the full self-paced review. So you'll get access to all of those things. It will not be a monthly subscription. So it's really an extended deal because all of those other options are monthly subscriptions versus this one-time payment that is also discounted over $100. So thank me later. Don't say I have never tried to give y'all anything for the low, but I wanted to show my appreciation and give you access because a few of you have reached out about my paperback book, and I already had this prepared to be on sale for Black Friday. So here's your chance to receive it, okay? If not, you know that for Black Friday, these will be the offers. There will be another bonus included, but these will be the main offers if it's something you're interested in. But y'all, let's get into our questions. Question number one, a 38-year-old male presents to the clinic with acute low back pain that began 2 days ago after lifting a heavy box at work. He describes the pain as dull and aching, localized to the lower back with no radiation of pain down his legs. He has no history of trauma, and his neural exam is normal. There is no bowel or bladder dysfunction, and straight leg raises are negative. What is the most appropriate initial management for this patient with acute low back pain? Is it A, to prescribe a 5-day course of oral corticosteroids? B, recommend physical therapy and over the counter NSAIDs? C, refer for lumbar spine imaging to rule out a herniated disc? Or D, order an MRI of the lumbar spine? Take a moment and tell me what you got, y'all. All right, so similar question states, what is the most appropriate initial management for this patient with acute low back pain? So as I always tell y'all, reading the stem of the question is going to allow you to slow down to ensure you're answering what is being asked of you. But here, knowing this stem, it tells you everything you need to know here. How are we going to manage acute low back pain initially, right? And your best answer is B. You want to recommend for them to do physical therapy and over the counter NSAIDs. If it's no resolution, then we'll start to move to the other steps. But that is your initial step you want to do for priorities, right? Question number two, a 45-year-old male presents with a 2-month history of persistent sadness, lack of energy, sleep disturbances with early morning waking, and feelings of worthlessness. He reports a loss of interest in activities he once enjoyed, and he has had difficulty concentrating at work. He denies any suicidal ideation, but mentions difficulty maintaining relationships due to his mood. His physical exam is unremarkable. What is the most appropriate first line treatment for this patient with major depressive disorder? Is it A, an SSRI, B, a TCA, C, recommend psychotherapy and follow up in 2 to 4 weeks, or D, begin bupropion? Propion. I always mess that up. Tell me what you got, y'all. All right, similar question in here states, what is the most appropriate first line treatment for this patient with major depressive disorder? So again, this stem tells you everything you need to know. We're looking for the first line treatment for major depressive disorder. Remember that we know that this is major depression because it talks about the patient having these symptoms for 2 months, right? A 2 month history of it. So anytime it's greater than 2 weeks, it's considered major versus minor depression, okay? So you know first line therapy is an SSRI. So A is your best answer. All right, and question number three, a 62-year-old male presents with complaints of urinary frequency, urgency, and weak stream over the past several months. He also reports waking up multiple times during the night to urinate and has difficulty initiating urination. His physical exam is unremarkable except for his digital rectal exam shows an enlarged prostate. His serum PSA is within normal limits. What is the most appropriate first line treatment for this patient with symptoms of BPH? Is it A, you want to start tamsulosin? B, start finasteride. C, lifestyle changes with reduced fluid intake. Or D, refer for surgical intervention. Take a moment to tell me what you got. All right, so similar question here states, what is the most appropriate first line treatment for the patient with BPH? All right, so a few things. Um, if a question is telling you, enlarged prostate, you're thinking BPH, you can also think of prostate cancer, but it also shows us that the PSA is within normal limits. So that's confirmation that we're more so leaning to BPH. And the stem of the question lets us know that we're looking for first line treatment for BPH. With this, that first line therapy is A, you want to start your tamsulosin, your Flow Max, to help increase the flow, to maximize the flow, is what I say for my Britney's Brilliance. All right. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the resources I do offer are linked in the bio of this channel, but the most benefit to have access to all of those things right now would be to maximize it through the MP Week special with the early access to the Black Friday sale, as it offers everything that's in my on my bio of my channel at a discounted rate. All right, you guys, you know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.